Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. COVID-19 induced anxiety and depression a concern, warns WHO. WHO warned of a sharp increase in the prevalence of anxiety and depression related to COVID-19 pandemic who were socially isolated or even quarantined. A scientific brief released by the WHO says that in the first year of the pandemic, the global prevalence of anxiety and depression increased by a massive 25%. The survey released said that 90% of the countries surveyed, including mental health and psychosocial support in their COVID-19 response plans. Unprecedented stress has been caused by a social isolation resulting from the pandemic. Also, distance and lack of support from their loved ones has been the main root cause of suicidal thoughts among healthcare professionals. So, the message is stay close to your loved ones and care. A new research suggests a causal link between blood group and severe COVID-19. One of the proteins, that is the ABO, that was identified as having a causal connection to the risk of developing severe COVID-19 determines blood groups. This suggests that blood groups do play an important role in whether people develop severe forms of the disease. A new study has analyzed over 3,000 proteins to identify which are causally linked to the development of severe COVID-19 infection. This is the first study to assess such a large number of group of proteins for their connection to COVID-19 that provides us an insight into the potential new targets for approaches to treat and prevent severe COVID-19 infection. It was published in the PLOS Genetics. The study used a genetic tool to screen over 3,000 proteins, where the researchers identified 6 proteins that could underlie an increased risk of severe COVID-19 and 8 that could contribute to the protection from severe infection. Arthritic drug to reduce COVID-19 death, a UK trial. Several drugs are being tested for preventing COVID deaths and managing the pandemic. Scientists and doctors welcomed the addition of baricitinib to few treatments already shown to help treat severe COVID-19 infection. Baricitinib inhibits the Janus kinase enzymes, which are intracellular enzymes involved in stimulating hematopoiesis and the immune cell function. The recent recovery trial, as we talk about it, said that Eli Lilly and Incyte's arthritis drug baricitinib helped reduce the risk of death in hospitalized COVID-19 patients by 13%, regardless of which other coronavirus treatments they were given, according to a large British study. The results showed 546 patients in the usual care group died within 28 days, but only 513 patients in the baricitinib group died where they were also given a corticosteroid like dexamethasone, tocilizumab or remdesivir. Gel-like sieve in blood vessels, a new target for repairing damaged hearts. The gel-like layer called the glycocalyx lines the inside of the blood vessels and acts like a sieve to regulate how nutrients move from the blood to the heart and other tissues in the body. Now, drugs that repair damage to a gel-like layer in the tiny blood vessels of the heart could present a much-needed treatment for heart failure in people with diabetes, according to the University of Bristol-led research funded by the British Heart Foundation and recently published in the Diabetologia journal. To see if repairing the glycocalyx, which is the outer covering, improved the function of the heart, diabetic mice were given a substance known to restore the glycocalyx. These findings have far-reaching implications in protecting against other types of organ failure, since the glycocalyx is present in all the blood vessels. Strength training exercises lowers risk of premature death, cancer, diabetes and cardiovascular disease. The findings of a new study show that muscle strengthening activities are inversely related to the risk of all-cause mortality and major non-communicable diseases such as the cardiovascular disease, diabetes, total cancer, lung cancer specifically. The goal of the present study was quantifying the correlations between muscle strengthening activities and the risk of developing non-communicable illnesses and death in people irrespective of the aerobic activity. In conclusion, the findings of this work does point out that lifting weights in the gym appears to lessen the risk of all-cause mortality as well as the chance of developing non-communicable illnesses such as cancer and cardiovascular diseases. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.